Hello, Health Center advocates. Now, since we last checked in, there has been a lot of political theater, a delayed bill process, and some unnerving news as it is related to our federal budget. So we have plenty to cover in this month's Alliance Advocacy Update. So let's jump into it. Governor Hobbs and members of the majority party were going at it all for the month of April over properly funding the Division of Developmental Disabilities. Now, this back and forth, this political theater, did eventually lead to a moratorium on any bills being signed until the members of the legislature were able to deliver a bill across her desk that adequately funded the division. And that did eventually happen and was signed into law on April 30th, right on the deadline. And we can thank a lot of that to the efforts of Representative Willoughby and Representative Gutierrez for their bipartisan efforts to making sure that that bill was signed. Now, with that moratorium finally being over, there were a handful of amazing bills that were able to be signed into law. That does include HB 2001, which allows recent behavioral health graduates to continue working with their client population upon graduation with a temporary licensure while they pursue that permanent one. HB 2175, which no longer allows the use of artificial intelligence to be the final decision maker when it comes to claim denials. And SB 1291, which mandates that all health insurance companies complete their credentialing process for providers within 60 calendar days. Since then, both the House and Senate have taken some time off from the legislature. The members of the House will be returning tomorrow, May 20th, and members of the Senate will be coming back on the 28th, and then we get into the budget process. Budget conversations are hopefully picking up, and I say hopefully because these are closed-door, private conversations typically happening between members of leadership and the governor's office as well. And so we are in the process where we're waiting for that traditional budget sheet leak. But as always, you can be ensured that the Alliance will inform you on all matters that relate to health centers in the budget that like items like graduate medical education, comprehensive dental care, and so many more items. Over the past week, budget bill provisions have passed both out of the House Energy and Commerce Committee and out of a House budget panel that would lead to immense cuts in Medicaid funding. I will highlight some of those potential cuts on this chart here. Now, these potential cuts would lead to an additional 8.6 million Americans being uninsured and a $715 billion reduction in health funding. So I know you must be thinking and a little concerned about what this could potentially mean for our health centers, for the clients, and for the communities that we serve. And you may have some pieces already in mind of you being understanding just what type of impact this may have. And so I want you to take the understanding, and I have two calls to action for you. One, I will highlight this webpage on the screen here, aache.quorum.us. On this webpage, you will see all of the Alliance's calls to action, where we provide you the opportunity to both email and call your members of Congress just to highlight how important Medicaid funding really is, both to their constituents and to your communities. While these are some trying times, it is important now as ever it is for us to stay engaged and stay involved, and we hope that these monthly updates are a way for you to continue to do that as well. So if you have any questions, feel free to email us at advocacy@aachc.org, and until next time.